Hi everyone, I'm back again. I want to talk about Clonidine. Yes, Clonidine. Have you heard about that before? Are you on it? Someone close to you is on it, or you are a physician, you want to prescribe Clonidine? Yeah, okay. We need to know everything about Clonidine. But before I move on, I need to categorically state here that I am not an agent of any manufacturing or pharmaceutical company, or I'm not a sales rep of any company or any establishment selling Clonidine. What I have done here in my channel and I'm about to do today is just dishing out the necessary information when it comes to your health and certain processes or medications that we are using in medical field. So that is what this presentation is all about. So I'm not representing any establishment or any pharmaceutical company. So with that, let's go. Clonidine is an alpha-2 adrenergic agonist. It's a very strong anti-hypertensive. But by the time we are done with this presentation, you will know it's not meant for hypertension alone. It stimulates alpha-2 receptors in the brainstem. It decreases activities or enhances inhibitory neuron. Then, it will decrease sympathetic outflow. It will decrease peripheral resistance to lower the heart rate and lower the blood pressure. That's why we'll take into account the possible side effects of this medication later on. The pain signal transmission is presented at presynaptic and postsynaptic, junctional, alpha, and adrenoceptors, hence pain relief when used as epidural. Note this: immediate release forms of clonidine will have onset of action in 30 minutes to 1 hour. Extended release forms will have onset of action that is very long enough and could be between 1 to 2 weeks. While patch forms of clonidine will have onset of action in 2 to 3 days. It could be a form of injection, patch, epidural injection, extended release tablets, oral tablets, immediate release type, and it is not expensive. Okay, to my colleagues, we can use clonidine for hypertension, for insomnia, post-traumatic stress disorder, diabetic neuropathy, restless leg syndrome, TICS, attention deficit and hyperactive disorder, smoking cessation, migraine, and of course the list goes on. Menopausal hot flashes as anxiolytic agent, alcohol withdrawal, ulcerative colitis, for shivering post anesthesia, for hyperhidrosis, good for A-Fib, pheochromocytoma diagnosis, and tardive dyskinesia. That is in psychiatry. The brand name is Catapress. or Cadapress TSS1, Cave, Cadapress TSS2, Duraclone, Cadapress TSS3. The dosage of clonidine could be 0.1 milligram per oral twice daily, or 0.1 milligram for 24 hours if you use the patch, and you replace each patch every 7 days. 30 microgram per hour if you are using epidural infusion for pain, or 0.1 milligram extended release per hour at hour of sleep for attention deficit and hyperactive disorder. You can increase by 0.1 milligram every 7 days until you obtain expected results or results. You have to involve your pharmacist and OBGYN if you are handling a pregnant or breastfeeding mother. Cadapress TSS1 patch, we have 0.1 milligram in 24 hours, or Cadapress TSS2, we have 0.2 milligram in 24 hours, or Cadapress TSS3, we have 0.3 milligram in 24 hours. What are the side effects? Hypotension. That is what we are going to contend with the most. Hypotension, drowsiness, fatigue, lethargy, headache, abdominal pain, depression, confusion. Of course, bradycardia, or some people will call it low heart rate. Still on side effects, cold fingers, low urine output, that is oliguria, skin rash, shortness of breath, fever, fainting. Of course, somebody with bradycardia and hypertension will be fainting, nightmares, and wheezing. Still on side effects, someone is whispering to me while taking this medication if side effects are this many. Of course, about the good things that medication could also do for us. Restlessness, impaired sleep, increase in weight, urticaria, hips, dilated neck veins, chest pain, meiosis, constipation, blood vision, hair loss, orthostatic hypotension, renal phenomenon, heart failure, gynecomastia, and erectile dysfunction. What are the possible drug-drug interactions? Clonidine will interact with alcohol and certain food items. So be careful if you are going to prescribe or you are placed on clonidine and you have the following situations. 1, depression, hypotension, bradycardia, renal failure, sedatives, or you are on any other anti-hypertensive, because it's going to have what we call synergistic effect on the blood pressure lowering capability of any other antihypertensive agent. Adderall, if you are on Adderall, that is amphetamine and destroamphetamine for attention deficit and hyperactive disorder, any youth or child on that medication must not take clonidine at the same time. So with that, I've come to the end of this presentation. I hope this will benefit someone somewhere. Kindly subscribe to my channel and you'll be able to get my presentations immediately they are published. Thank you. I appreciate that.